Hi guys, welcome back. Dr. David here. In this video, we talk about how to relieve rotator cuff tendinitis and shoulder impingement pain. We're going to go over all the techniques and the anatomy behind the rotator cuff, what it does, how to fix it, and how to get you out of shoulder pain. So if that is something that you're interested in, make sure to hit the like button and stay tuned and watch until the end. When it comes to rotator cuff tendinitis or shoulder impingement, the first thing we have to talk about is, well, what is the rotator cuff and how does it become impinged? Because without understanding that, we can't understand what it is that's bothering us and what's causing the pain, and then of course how to fix it. The four rotator cuff muscles that stabilize the shoulder are as follows: the Subscapularis, Superspinatus, Infraspinatus, and Teres Minor, and there's also a bonus fifth one that I'm going to mention shortly as well. First rotator cuff muscle is called the Superspinatus, and it's called the Superspinatus because it's on top of what we call the spine of the scapula, which, as you see over here in this picture, is the middle area of the scapula. There's a little ridge there, and on top of that ridge sits the Superspinatus. Now, the Superspinatus is a really important muscle because not only does it help stabilize the shoulder, but it also helps initiate lifting of the arm. And so when the Superspinatus is torn or impinged, which I'll discuss later, that's why you have a lot of pain when you start to initiate movement of the arm. Rotator cuff muscle number 2 is the infraspinatus. So just like the Superspinatus was above that spine of the scapula, the infraspinatus is below it, thus infra. And what it does is it's also a stabilizing muscle of the rotator cuff, but it also helps move the shoulder out. So that's why you'll see a lot of people doing rotator cuff strengthening, moving the arm out, because that's what the infraspinatus does. Subscapularis is rotator cuff muscle number 3, and that attaches into the inside of the shoulder blade. So you can't really get it from the outside, but you get it more from the inside. And that muscle as well helps to stabilize the rotator cuff, as well as bring the arm in. So Superspinatus, Infraspinatus, and Subscapularis comes in. Rotator cuff muscle number 4 is called the Teres Minor. It's similar to the infraspinatus, it's a little smaller, and it also helps to bring the arm out and stabilize the shoulder within the socket. There's a fifth muscle group that's not considered to be in the anatomy textbooks part of the rotator cuff, but does really act like it. In other words, it helps stabilize the shoulder, and a lot of times is implicated when it gets impinged, and that is the biceps tendinitis, which actually connects into the front of the shoulder. So anyone with pain in that front of the shoulder area gets diagnosed with what's called biceps tendinitis, and that is simply just inflammation of the tendon from the biceps that connects into the shoulder area. Now, before we move forward, it's so important to understand that the rotator cuff, even though it has isolated motions of the shoulder, the one thing that they all do together is they help stabilize the shoulder in the socket when it's lifting up. And so if it's not able to stabilize the shoulder joint neutrally in the socket, that's where people start to develop what's called rotator cuff tendinitis and shoulder impingement, and we're going to talk about exactly how that occurs right now. Really important to note, the rotator cuff muscles are usually not what are torn. What are typically torn are the rotator cuff tendons. And so the muscles of the rotator cuff actually start in the shoulder blade area. That's what I was talking about, infraspinatus, supraspinatus, above and below the spine of the shoulder blade. They're usually in the back. And then they all come up right into the top over here. All four of the tendons meet up over here. That's why when people develop rotator cuff tendinitis or shoulder impingement, it's from tearing of the tendons up here, but not the actual muscle bellies over here. So here's what typically happens with shoulder impingement and rotator cuff tendinitis. Over time, because of poor posture, the shoulder joint comes further forward as people sit in this posture over and over and over again. And this is slow and takes time. Once that shoulder comes too far forward, it starts to migrate up. The shoulder joint itself starts to migrate up, and then when it migrates up and you start lifting your arm, you start to crunch and impinge on those tendons that are in that area. And so over time, those tendons start to fray. And that's where you develop the impingement, because those tendons are becoming impinged under the shoulder area. And then that subsequently leads to rotator cuff tendinitis, which is inflammation of those tendons. And it starts off very mild, just with some fraying and some light tendinitis, and then slowly over time turns into tearing. Now here's the $1 million question that everyone always asks me. David, since I tore my rotator cuff, shouldn't I be getting surgery? And the answer is it depends. There are two main ways that people tear their rotator cuff. Either it's an acute movement where they lift something super heavy and it just all of a sudden snaps and then they can't really lift their arm up. That would be a case that surgery may be considered, although not always. The second way, and the most common way, is over time, like I just talked about, the rotator cuff tendons fray and fray and fray and fray until they develop tears. Usually partial tears, sometimes full tears, and typically surgery versus non-surgery, according to the research, yield very similar results. And so really important to try conservative care first, whether that's physical therapy, exercising on your own, injections if you need to try to relieve these postural problems to create more space in the joint and decrease that tendonitis so you could avoid further surgical interventions in the future. So if you're feeling pain in the front of the shoulder, that's typically biceps tendinitis. If you're feeling pain in the back of the shoulder, now you're getting to more the infraspinatus or Teres Minor tendinitis. And so we're going to talk about what to do when you start feeling pain in the front and in the back. The way to treat rotator cuff tightness and shoulder impingement is not, let me repeat that, is not through strengthening the rotator cuff. Strengthening the rotator cuff is a great thing to do when the rotator cuff is healthy and in a good position. But if it's torn, especially if it's partially or fully torn, then you're strengthening something that's already inflamed and has tendinitis and tendinosis, which is chronic inflammation. The best exercise and techniques to do for rotator cuff tendinitis or shoulder impingement are postural strengthening. Because by putting your shoulder and your posture in a better position and in better alignment, that's how your rotator cuff is going to naturally get stronger. The other way is to strengthen the deltoid muscles, which are the superficial muscles of the shoulder. We are going to do a whole video next week on postural strengthening, so make sure you hit the subscribe button and the notification bell so YouTube lets you know when we post that video, because that is going to be the way to strengthen your shoulder muscles and therefore decrease your shoulder pain.